again, I'm Katia Magalhães from Polytechnic Institute of Viseu, Portugal. Again, congratulations for organizing this wonderful and interesting conference. This second the second communication is entitled Self-Care, Empathy, and Positive Mental Health in Higher Education. When we talk about social intervention, we know that it's an intentional global action that aims to modify problematic social situation in order to improve people's and community quality of life and develop autonomy and solidarity. It is a well-founded approach and intervention that want to achieve a true social transformation. The social professionals are dedicated to those who are often forgotten or invisible to most people and seeks in an integrated way to build a sustainable and healthy life project as a response to social problematic situation. Although this work is sustainable to the development of psychological distress and also anxiety, depression, and burnout syndrome can be associated, can appear on social professional and can be associated with factors that are related to work, to the practice, and to the obligations and needs of this relationship, not only with themselves, but also with the public of their intervention. Also, with the fact that these professionals have to deal with their own emotional and psychological needs and with the emotional and psychological needs of those with their work. So working in environmentals with high exposure to stressors and trauma experience can lead to the emergence of psychological risks. That can be, as I said before, an increase in stress, anxiety, depression, and a serious decline of mental and physical health. Hence, it would be important practice. It would be important the practice of empathy, self-care, self-awareness that can contribute to better mental health quality outcomes and can improve their relation with others. Self-care has been defined as the ability of individuals and communities to promote health, prevent disease, and maintain health, and to cope with illness and disability with or without support of healthcare provider. So self-care as a health and well-being strategies begins to constitute itself as an intervention, and it start being truly valued for organizations and workers. And can have major implications for the professionals interfering in the quality of the practice. And in this way, some studies have shown that for this reason, this practice of self-care, but also empathy and other concepts should be listed in academic curriculum and also considered in ethics and deontological manuals. When we talk about positive mental health, we are talking about, according to World Health Organization, as mental and psychological well-being that is related with the way you feel about yourself, but also the way you deal with external situations and the quality of your relationship. And this have a direct and indirect contribution to the way you realize your own potential, work productively, cope with the normal stresses of life, and also make a positive contribution to the community. Empathy also has been defined as the ability to understand the personal experience, but also would be very important to in the relationship that social professional develop with the client, with the individual that he is working, and constitutes an important skill for health professional, but also literally have shown that it could be very, very important in social area, because it will help professionals to understand better people's feels, opinions, and experience, even in very risk social contexts, in order to assess their real needs and act accordingly, offering a tailor-made social intervention and work. And this would be very, very important So to social professionals reach their goals with their own clients and individuals. In this sense, and when we think about these three concepts, the literature and evidence has been has shown that professionals that have higher levels of empathy, self-care, and positive mental health will work more efficiently and will be more able to promote individual and social changes. This will also be important because the practice of self-care, empathy, self-awareness that can contribute to a more positive mental health will help professionals to self-protect themselves, but also it will help them to protect others and to decrease some dysfunctional psychological symptoms as depression, anxiety, fatigue of compassion, and this will help to promote more efficiency practice. Although according to our literature review, we found that there are previous research that shows a positive and significant association between these variables, but when we are talking about the relationship between these variables and the importance to train this self-care, empathy, positive mental health, and social students from different backgrounds, we didn't find studies in this area. So we think there is a dearth of literature and research that studies these variables and the importance of training during higher education. So the aim of the present study was to assess the levels of self-care, empathy, and positive mental health in a specific and a small sample of students of higher education. They are doing a degree in social education, and try also to study the associations between self-care, empathy, and positive mental health. We want to highlight that this is a first study. This is only a pilot study with a small sample and non-experimental. So it will be something that I will talk later in our limitations. The instruments that we use, we ask students to complete short sociodemographic questionnaires with questions such as age, gender, etc., but also questions related to their situation, for example, with who they live, place of residence, etc. And the instruments that we use are instruments related to this variable, specifically empathy, positive mental health, and self-care. All the instruments were translated, adapted, and validated to Portuguese population. Also, all participants were informed about the purpose of this study and agreed to participate on a voluntary basis. The response were confidentially updated, were sure, and participants were also provided any necessary clarification during the study. Also, to analyze the data, we use SPSS, and we use the test accordingly with the standards of normality and homogeneity of the sample. Overall, and I will give you only an overall perspective of the results, and please feel free to email me to exchange some ideas or thoughts about this. Overall, the sample was composed of 58 Portuguese students. The majority are females. They are doing a social degree. The age range was between 18 and 52, but with a mean age of almost 21 years. They are the majority from a urban area, and the majority are single and don't have children. Also, the majority live with parents or friends or colleagues. The results about our instruments were, we have good results of internal consistency for the three instruments that we use, and for better understanding the phenomena that we want to study, we analyze prevalence of self-care, empathy, positive mental health, and some associations. Overall, the result shows that the levels of self-care, empathy, and positive mental health are on average, but they can be improved. They don't have real high results. They are on average in some cases, a little less. Regarding associations between these areas, we found between self-care and specifically subscales of individual health and care behaviors and autonomy relationships, and also personal satisfaction subscales between the subscale self-awareness of self-care and more ability to problem resolution and competencies and satisfaction also between self-care strategies and competence and such fashions of positive mental health, and also when we have more self-care behavior, more capacity of problem resolution. I want to highlight that we found positive association and significant difference between these subscales of self-care instruments and subscales of positive mental health, but we didn't have any significant difference between the scales and subscales of total and subscales of self-care and empathy, only between self-care subscales and subscales of positive mental health. So we found, and this is according to literature, that there is a relation between this variable that are very similar with previous findings. Also, we see that care of professionals with interaction in social contexts is very important, because we are promoting building positive practice that will protect them not only on the future but also during their training, and this could have an impact, and this could contribute to be more effective on their future practice. And as previous studies said, this the build and training strategies of empathy, self-care, self-awareness are very, very important and contribute to a better mental health, should be an ethical duty and a more imperative during professional and during practice, but also during training. So we think, and we'll leave this message to you, that prepare the students to the future practice is very, very important, because we are promoting more empathy, more communication skills, more relations skills. We are promoting more cautiousness, more compassion, and this could help not only themselves to lead with very stressful situations, but also will help them to have and establish a more positive relationship with others and be more present and more compassionate to help them. So before finish, I just want to remind, as I said, this was just a first in-pilot study with a small sample. So this is a important limitation of our work. A larger sample size will be important to be more representative of the population of studies. So it will be important to do this with different higher education studies with different years of degree. Also, the link of prior research studies on this topic was something that limited the discussion and also the review that we did about the literature. We think that it could be also important in the future to develop more studies concerning this. That could lead us to also other important idea that we should start thinking on developing training education programs during higher education that focus the development of self-care, empathy, self-awareness, compassion, and positive mental health for students. Some reference. Thank you for your attention. I leave my email, so please feel free to send me your questions, your comments about this. I will be happy to discuss this topic with you and even to find ways to collaborate or to expand the studies on other contexts. Thank you very much again for your attention. Bye.